Welcome to This Explainer. Today, we're diving straight into the fascinating science of how children learn, unlearn, and ultimately shape their behaviors. We're going to explore the foundational theories of child psychiatry that govern everything from overcoming deep-seated fears to managing really complex behavioral challenges. Rewiring behavior. I know, it sounds a little bit like science fiction, right? But here's the thing. The most complex psychiatric treatments for kids are actually built on three simple yet incredibly powerful learning paradigms. Honestly, once you understand these, you've basically got the keys to the engine that drives clinical change. So here is our roadmap for the explainer. 1. The 3 pillars of learning. 2. Unlearning fear through classical conditioning. 3. Shaping behavior with operant conditioning. 4. Observation and imitation in social learning. And finally, 5. Integrating therapies for better care.
All right, jumping into section 1, the 3 pillars of learning.
You're probably already familiar with the big names here, Pavlov, Skinner, and Bandura. Well, this master map shows a really fascinating progression. We shift from involuntary stimulus associations on the far left to behavior and consequence associations in the middle, and finally, all the way over to observation and imitation on the right. As you can see, each of these requires a totally different level of active participation from the learner. Moving right along to section 2, unlearning fear with classical conditioning. So the absolutely crucial point to grab here is that the learner is completely passive. Picture a child dealing with severe anxiety or PTSD. That fear response, it's completely involuntary, literally like a reflex. It's usually driven by some past aversive event that triggered extreme arousal, which then unfairly hitched a ride onto a previously harmless cue in their environment. And this is exactly where systematic desensitization steps in. Now, when a kid goes through exposure therapy, we're not scratch that. We can't just erase that old fear memory. Instead, systematic exposure creates a brand new inhibitory memory. It suppresses the fear response by repeatedly proving to the child that the terrible outcome they're anticipating just isn't going to happen. To put into perspective just how effective this classical conditioning approach is, let's look at the numbers. The number needed to treat, or NNT, for cognitive behavioral therapy with exposure in mild to moderate childhood anxiety is just 6. Literally 6. In the psychiatric world, that is remarkably low, which makes it the absolute definitive first-line treatment for these disorders. Let's transition to section 3, shaping behavior through operant conditioning. Now, notice the dramatic shift here. Unlike that passive reflex we just talked about in classical conditioning, this child is an active learner. They are emitting voluntary behaviors, and those behaviors are going to either increase or decrease strictly based on the consequences that follow them. Okay, this is a concept people get mixed up all the time, so let's clear it up for sure. Both positive and negative reinforcement aim to increase a behavior. Positive reinforcement might look like praising a child to increase their compliance. Negative reinforcement, on the other hand, is removing something bad to increase a behavior. For instance, think of an anxious child. Avoiding trauma reminders reduces their distress in the moment, which unfortunately heavily reinforces that avoidance behavior going forward. As clinical experts point out, when we're dealing with disorders like ADHD, the therapy isn't just about treating the child directly. It fundamentally shifts towards teaching the parents to systematically shape their child's behavior using these exact basic principles of behavior modification. So what does this look like in the real world? Well, it translates to specific tools like token economies, systematically ignoring whining, which is tough, I know, and setting up daily report cards at school. Based on the landmark MTA study, these operant techniques, especially when paired with medication, provide huge, lasting positive behavioral effects. And here's the truly amazing part. Unlike medication alone, these behavioral improvements tend to persist long after the intervention even stops. All right, moving into section 4, observation and imitation in social learning. You've probably heard of the classic Bobo doll experiment from the 1960s, right? Where kids learn to roughhouse with an inflatable clown just by watching adults do it. Well, Bandura proved something completely revolutionary there. He showed us that children don't actually need to experience a direct reward or punishment themselves to learn a behavior. They learn vicariously. They literally just need to watch someone else perform a behavior and see the consequences that person faces. So the big takeaway for us here is that a child's environment, and specifically the models they see around them, are just as critical as any direct discipline.
If a child sees aggression consistently reinforced, or even just ignored in their environment, they're going to adopt it, entirely through observation. In clinical practice, this knowledge is just incredibly empowering. It means we can use group-based parenting programs like the Incredible Years, where facilitators model skills and parents role-play together. These parents then become empathic role models for each other and ultimately for their children, which dramatically reduces early-onset conduct problems.
Bringing it home with Section 5, Integrating Therapies for Better Care.
Okay, so when we step back and look at the big picture, we see how something like cognitive behavioral therapy for anxiety doesn't just use classical exposure in a vacuum. No way. It weaves the whole shebang together. It uses exposure to extinguish the fear, contingent operant rewards to motivate the child to actually do the exposure, and social modeling, where the therapist role-plays coping skills. It is a fully integrated, multidimensional approach.
We see this exact same powerful integration in parent-child interaction therapy, or PCIT, which is used for conduct problems. We don't just jump straight in with rules. Instead, we sequentially combine relationship building through warm social learning in Phase 1 with highly structured operant discipline in Phase 2. This exact 1-2 punch is proven to achieve massive, lasting reductions in behavioral problems.
As we wrap up this explainer, I really want to leave you with this provocative thought. If clinical psychiatry uses these precise, evidence-based tools to effectively unlearn severe anxiety and manage complex behavioral disorders, imagine just how powerful applying these simple principles of exposure, reinforcement, and modeling can be in guiding healthy, everyday childhood growth. Think about it. Thanks so much for joining me.